What are you going to do?
I'm going to.
This is your patient.
The patient is just 3 days old with a hernia so dangerous a surgeon has to operate immediately to save his life.
My CO2 levels are going up higher. Can you do anything? What are we going to do?
It looks bad for the newborn, but this time it's okay. The surgical resident will have a second, third, even 50th chance to perfect this rare procedure in Northwestern University's simulation lab.
I think it makes all of us residents feel better about our ability to deliver optimum care by being able to practice on these models rather than the patients.
It gives the learners a safe environment in which to work out the kinks. They can make their mistakes before you ever have a real patient in front of you.
Catherine Barsness is turning the next generation of good doctors into great ones.
I can stress them. What are you going to do? Did you see leakage? I saw something leaking. And I can make them perform under each and every single stressor. What are we going to do, Dr. Gaz?
I'm going to remove the instruments and desufflate the chest.
Okay. Some of the professional skills are the ability to communicate with your peers, the ability to take leadership in critical moments.
Being able to learn how to handle the needles and the laparoscopic instruments, those are the kind of things that are universal to a lot of different operations.
These realistic 3D models are designed to mimic the complex yet delicate structure of infant organs.
Isn't that a beautiful maneuver?
That is.
I know I don't want my grandchildren having an operation by somebody who hasn't done one. I want the person who says, I'm an expert and I can prove it.
When life and death is determined by the slightest flick of the wrist, practice doesn't just make perfect, it saves a life. I'm Marty Salt reporting.